Good morning, good afternoon, and good evening. Welcome to the 569th day of continuous Zooms at IFPH. Today, our guest is Dr. Javed Akhtar, BHMS, BSc Clinical Pathology, MPhil Physiology, a legend from Pakistan, member, National Council for Homeopathy, Chairman of Professional Development Program of Homeopathy, Government of Pakistan.
Today, I have selected a topic, inherited epidermolysis bullosa. Basically, first I'm going to give you some information why I selected such topic, and what is the significance of this topic, and why homeopathy, a role of the homeopathy in such kind of disorders. Normally, this disorder is inherited. As we know, inherited disorders does not scientifically, as we know, there's no response in any kind of system of treatment. Today, I have treated the case by homeopathic medicine. The case was most likely it was eradicated by this such medicine, number one. Second number, if you take it, this kind of disorder, if go to the other type of systems, it takes, if the care, the management, the palliation treatment takes a lot of time, even then not responded properly. If you go to the homeopathic side, homeopathy, we know we have to choose the ideal treatment for such type of disorders which can palliate or cure with less time, with minimal damages. So thus, homeopathy, with few doses, the patient responded more than 80 to 90%. So I'm going to present here of the presentation of the case.
Yes, sir. Okay, sir. Right.
Sir, please.
Yeah.
This is the abstract of a 2-month-old baby suffering from skin disease, epidermolysis bullosa. Simplex. Dowling Mera type EBSDM is a basal type of epidermolysis bullosa simplex characterized by the presence of generalized vesicle and blisters in the grouped form on abdomen, legs, face, and feet. The case is clinically diagnosed and treated symptomatically by Segal's protocol of homeopathy. Epidermolysis bullosa is an inherited skin disease with 4 main subtypes that cannot be distinguished clinically at birth. All subtypes may present with widespread life-threatening blisters in fragile skin, making treatment and handling of the newborn with EB challenging. The prognosis of EB depends on the subtype, and therefore maximum treatment is necessary until the final diagnosis is known. A few doses of Pastella paternosis 6C were given to the baby, disappearing skin blisters vesicle after 2 weeks of therapy. EB is a rare medical condition that results in easy blistering of the skin and mucous membrane. Blisters occurs with minor trauma or fraction of and are painful. Its severity can range from mild to fatal. Mutation at 16 different genes, autosomal dominant and recessive underlying defect layer of skin, 4 main types: epidermolysis bullosa simplex, dystrophic, junctional, and Kindred syndrome. They have 4 main types. The prognosis is very poor. Our management is involved, but in homeopathy, you can see the miracle. Now I'm going to what the case, how the homeopathy case handled, and how I can see the patient and what kind of history taking, what kind of observation during the homeopathy. I'm mentioning. This is a very important part of the homeopathic. In allopathic side, you have to go to the diagnosis basis on the what is the pathology. In homeopathic, you are treating the patients and what the patient do react, concern, and reaction in the suffering condition. A male baby of 4 months of age was brought to my clinic by their parents. His father telling me his birth took place at home with normal delivery. My child is suffering after birth. His skin becomes sensitive, blisters formation. After a few days, I visited a child specialist and skin specialist. They advised antibiotic, lotion, creams, etc., but no relief. Now someone suggests I visit to you. Observations. Skin specialist and all the concerning doctors who did it, whatever their mode of treatment, but the child does not respond any kind of any treatment. I observe the patient for 20 to 30 minutes. Just observe. I told to the patient, sit there, and I have seen the patient. A child continually weeping without any break. Her mother moving gently to and fro, continually, and caressing her all the time, but the baby desired to be rocked. It was my observation. I asked the mother, and she replied me, baby weeping all the time, and I am too much exhausted to carry child. If I leave for a while, start too much weeping. Thus we rocked gently and carried all the time. Then I asked the patient, tell me about yourself when you was pregnant. One thing I'm going to tell here, when you take the case of inherited disorders or the case of the child or infants, here very most important factor, adaptation. The adaptation is start from the after the conceiving of the pregnancy. In all the fetal life, it was start from that time. So the mother's history is must be considered here. Actually, now she's telling me about their. I asked the question in the pregnancy, what happened to you? Actually, my hubby loses money in business. We suffered a lot due to the loss of finances. After that, my hubby behavior was too much rude and abusive. I was very humble and careful, but it was apprehension. He may not divorce me. It was a throughout pregnancy, it was happened to. Now you can see that this was the case history. Now you can see the baby. I took the picture of the baby. It was the face of the baby. It was 4 month child. Now you can see the legs here, epidermolysis bullosa. You can say blisters, vesicles, and like skins. In the posterior part of the hand, legs, feet. Abdomen. These are the, you can see the vesicles. Here, skin has become fragile where you can touch it, just touch it. The blisters and vesicle formation takes place. Clinically, it is clear cut diagnosed by the skin specialist and me too. It was resembled to the epidermolysis bullosa. Now, the case is taken on the CAR and triple P. The case demonstrates the mindset of the individual, focus about their concern, reaction, and adaptation. Now, on the basis of CAR field, the patient mindset can convert into rubric on the basis of present successful predominant to reach the similum. I have taken the rubrics of this. As you know, she told me when I was in pregnancy, it was losses of financial loss. I took the rubric ailment from money from losing. Secondly, what was the behavior of their husband and family? Ailment for rudeness of others. She took the And third one, ailment from abused after being married in. Third rubric I've taken it. Fourth rubric I have taken, fear separation of husband from. He may not divorce her. And fourth rubric, fifth rubric is careful of. She was telling me that I am very careful to family. Careful of domestic affairs about. Now the five rubrics from the mother side I've taken it. The next one is the carest being desired to be carest all the time. The baby demands he carest all the time. He will do it. And the baby was weeping, desired to weep all the time. Walking, desired to be rocked. These are the observatory rubrics which I have seen the baby. And the mother told me to clarify all the symptoms. This is a chart by radar opus FX. You can see here pulsatilla is coming with totality of symptoms. Now I've given the pulsatilla 6C water dose given first day in my clinic, and now I advise it you can give a third day and sixth day and ninth day. I have given the 4 days. Patient comes from very broad, and for 2 weeks I have given the medicine. But I told to her, respond me after 1 week. So patient father replied on the phone after 1 week, said the baby is improving. And what kind of improving? Is he was reducing the scars and weeping and all these things are a little bit improved. Then patient visit me at second week. You can see after the 4 doses. This is the skin of the face. You can see the legs of the baby. All the blisters are most likely disappeared. And one thing I'm going to mention here, baby comes very poor family, they belong to very poor family, and they come after 2 weeks. And I took the placebo was then I gave the placebo for 1 month. And after 1 month, he did not visit. The patient was absolutely cured. And after 1 year, I called to him. They respond me. There's nothing to. Again, it was problems was occurred. No medicine was given again. This was the case of the EPIDERMOLYSIS BULLOSA. Here, Segal protocol use synthesis rapidly, Murphy, integrity, complete, dynamic, Bogers, and these are the radar opposite. Now I'm coming to the pulsatilla journey. What is the pulsatilla journey? Pulsatilla is bin flower. Pulsatilla is the most feminine type of pig because she lives almost entirely through her emotion and does not suppress them. She has intellect, but it is used exclusively in the service of her emotional needs and desire. She has intellect, but she is not using intellect for their desires and emotions. Emotions are very changeable things concerned with emotional aspect. It is the keynote feminine. As you know, what is the I mentioned is what is the criteria of the what is the characteristic of the feminine? Nurturing, sensitivity, sweetness, sportiveness, gentleness, warmth, specificity, cooperativeness, expressiveness, modesty, humility, empathy, affections, tenderness, and being emotional, kind, helpful, devoted, coordinations, effeminate, understanding, being cited as a stereotype feminine. This is the characteristic of the feminine. This is a typical feminine. If you go to the masculine side, masculine has a different type of characteristic. You can say Pulsatilla is the purely feminine. Now I've mentioned here the rubrics which is mentioned in Pulsatilla medicine: affection, mildness, affectionate, appreciation, longing for bashful, caressing, coquettish, charlatan, control, lack of emotional, children, and all these the rubrics are related to the yielding passive. These are the mentioned here. Just I'm going to next one. What is the Pastella concerns? Pastella is more personal in her interest than any other type. Her principal concerns revolve around her loved ones and her life. As a child, it was usually her parents. Later on, her devotion is transferred to her boyfriend and then her husband and her children. She is quite happy to stay at home and look after her husband and her children and free from ambition. She is extremely nurturing and enlarges her loved ones as much as she likes to be enlarged herself. She does not involve politics and philosophy. Homeopathy में one thing very important in Palestella is you can say that all these things in your home, loved ones. She is all rounding around our family. Loved ones, she doesn't concern anything. What happened? What is the politics? What is anything world of drama happen in the world and here and there? He doesn't concern. He first when she's a child, her husband was child, his mother and family, then wife, then husband, children. These are the total world of the homeopathy. These people. You can say here. I'm going to further. Time is too short, but it is a too lengthy topic. Emotional instability. Pastella just approach positive emotion as negative. Both emotions are same. She gets excited easily, particularly when she is loud. She is some anticipated good fortune with a loved one. At such times, she may be excitable and gets exhaust herself and then cries without knowing why, develop headaches. He is generally very fun-loving and extremely sociable, apart from nothing about. These are the rubrics I have taken: emotional instability, passivity, and simplicity. Pastella is, if she is feeling insecure in a relationship, she may behave normally with others, but demand absolute devotion from her mate and dissolve into hysterical tears, withdraws into silence if he does not get it. Pastella has very passive reaction, which resembles the kind of hysteria attributed to Pastella insanity in women who was mild, gentle, and tearful. She sits in prayer all the day, answering, nodding her head, yes or no. These are the, I'm going to, next one, time is too short, but here. Passive simplicity, these are the rubrics. Now I'm going to tell here, this is the Pastella children. She's nodding. I asked the question. This is the card head nodding. Confusion and partiality. If her thinking tends to somewhat bully, it lacks precision. Basically, Pastella is intellectual, but thinking is bully. Bully means hazy. It lacks precision and clarity. I must give an example. If you say to some light or bulb and any electric wire, you can place here and there and just switch the. He doesn't know how to do it. And because the rational things, the logical things, he can't do it. He had basically he can't do it. She can refer the case. This is a clear reality. And what is the one another thing? What is the reality? If there are number of cases, she visited the bazaar and whatever university. So she told my children, my children did A level. Oh, everyone she's telling me my child did A level, and she basically she does not, due to the confusion reality, and she does not know. Okay, most of people are doing the A level, but she is proudly and saying that my child did the A level. This is the reason of this. And confusion describing complaint happening at innocent. She's basically innocent. Pastella main. What is the Pastella main? All the characteristics of the feminine character is person having such type of things. That is called Pastella main. Pastella main is the accumulate. Basically, it does not mean compulsory wearing the suit of like a pile, keeping small things. You can say unmanly person. You can say these are the rubrics. Now I'm going to what is the feminine criteria of the people? You know, If the feminine, it should must be a takra takra, coquettish. It's a very you can say fragile and all these things. You can see this video. It's a coquettish. It is a coquettish. Nakra. This is the rubric coquettish too much. You can see here now. This is a too much. That is enough. One is a coquettish too much, and then the second one is a coquettish too much. ये काफी नहीं है और नखरा चाहिए. This is another rubric here, very important, marking with pieces. Before this, I'm going to explain one thing here. Mind feigning sick to be. This is a very important rubric. As you see, what is the feminine family? If this is observational rubric. If you see the patient, if you binding head and legs, whatever, she looks like a ill. So here you can observatory rubric, you can use Venice. Pastella is very important here. Now you can see it, you can ask when you see this child, you can easily ask, baby, what happened to your head? She told me I am a headache. This is observational rubric. Here, insanity erotic. You can stimulate by certain things that you can insanity erotic. But one thing I'm going to hear before this, here is a rubric, fear warm room, anxiety warmth from, irritability warm room in. What is the meaning of warm room? Why she isn't taking tension? Why she's a fear of warm room? Irritability. Basically, she told that her hubby, her boyfriend are not loving to her. And when warm room means the family of the Pastella are sitting in the rooms. They are talking with enthusiasm. They're happy mood. They're friendly. She told that they are doing very happily, but my hubby here doing a lot of gossip and doing friendly environment, but he's not caring myself. He did not give me an appropriate time. When I was sleeping, वो कान मोड़ के सो रहा होता है. I'm saying, but this is basically she tell that this person is sleeping with me without any physical affection. So she having anxiety, warmth from anxiety, fear, warm room. Where all the family are sitting. Then what she do it? Her irritability, warm room. Unconsciousness, warm room. And unconscious means when she is unaware and talk to the husband, come with me and talk to me. Don't bother to my mother and all that sitting around. Don't bother it because she knows they are not hearing me. This is like our unconscious warm. And that is here rubric marking pieces. Only single medicine pastilla. What is the meaning of marking? If you go to the direct meaning of this rubric, marking means you indicate the pieces. But why you indicate the pieces? Pieces mean rubbish things, the thing which are wastage things. And why you indicate such wastage thing? Because you give some message to the other one. She told, you can see here, her bra, her napkin is rages. She after the washing, whatever she outside of the room or whatever, her mother and sister will ask you, "Oh, your bra is rages. Your hubby did not buy new ones." Definitely, our neighbors once asked him, "Oh, you are too much religious." Definitely, mother and all the family. "Oh, he did not care me. He did not attention me. He did not bother me." So this is called marking. And it comes to the patient to you. He can tell, are showing something that my cloths are ruptured and something. Definitely, she's also manipulative too. Definitely, you ask your family, mother, father are not caring to you. No, 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 they did not give me any attention. This is called the marking with pieces. Basically, he shows they of their inner flips shown to the other people to take the rewards and attention. And here, one rubric. Sir, time is there or not? Time is going to be. Sir, here's the question time. I have what material about this. Can discuss with. Sir, should I continue or stop
Yes,
here?
sir. Yes, you can continue for another 15 or 20 minutes, sir. No problem.
Okay, okay. Thank you, sir. Thank you. Here, very important rubric I'm going to share. Character layoff. Alcoholism, weakness of character from. This is a very important rubric here. What is the meaning of character layoff? It does not mean the person having the beyond the doing some wrong thing. No, the pastella basically it is a submissive. She is a very obedient. As you know, but she obey all these things of the husband. She have no role, not any performing role of any other activity. Just obedient, submissive. She does not. Its only mission to care myself. Does not bother anything. She is not playing any role. Only character lack means she has no role in any activity. She has no role. This is called character lack. Lack. This does not mean characterless. It is a character, but as you know, typical feminine. As you know, if you see the history and typical woman, she is obedient to her husband. She does not participate in any other kind of activity. Just do domestic affairs and follow the instructions of husband, and she will do all those things. But the husband like it, but her father like it, but her children like it. She has no concern any of this. And she will not play the role. What happened around her and what happened in the society and what things. Just this is the time later. Just by one thing I'm going to mention. If the seller lady, basically, if the her husband brings a gold set, this is a she tell the people she is my carer. If she demand her give me more something, she will not ask my husband having her where he comes from the money. She has no concern this. She is doing she is involved with whatever the problem is. Now the rubric is alcoholism, weakness of character form. What is the meaning of alcoholism? Alcoholism is direct meaning of the person who is addicted with the alcohol. But here we can say she is addicted. What is the weakness of it? Does not mean the weak character. She of Pastella does not having the weak character because she needs attention. And when attention needs, she doing marking with pieces. She she is doing she another there are many rubrics. She is a corrupt panel and she's a liar. That time because it is a relevant term. When her needs not fulfilled, then he is doing like this. This makes things a little weak because she demands and she do lie for her husband. For example, I'm going to give examples. If her son, her husband did some crime and she will fight for her husband because she will tell the liar. She will become liar. She will become bribery. She can become whatever she can do it. But this is the weakness of character, and she is doing again and again, and this is alcoholism. Pastella mother. Here one another mother fixation. As you see the mother fixation. What is the mother fixation? Mother fixation basically she is very attached to mother. And what is the when her son got married, she demands her son most of the time spent with her. If he is not spent to her time and gives the time and gives affection to that baby, if he is not giving, then she's become alcoholism, weakness of character, she become liar, you can say corrupt, and all most of the rubrics are there, and all these things are lying at that time, but not before this. This is the alcoholism of weakness of character. Here, uh, and innocence, what is childish behavior? Because all these things she is doing with the childish behavior, the childish, simple, complaining, pitiful, and when the someone is come to you and she husband are when the husband not caring to her, not to the give the proper affection, and she bend the hair band, she bended the head, and husband asked, "What happened to you?" My day, maybe. What happened to you? He asked me, I did a lot of work at daytime. As you know, your mother did not participate in the chore of the home. And definitely, my husband will go to the mother, Mama, why you not give the time to do inside the doing the light thing? Then this is a called manipulative, and she is doing innocently too, and complaining pitiful way. He is complaining very pitiful and manipulative too. And our desire was indefinite and unattainable things desire. For example, I'm going to one example. A baby who comes to me, my mother told me if I was in the market, there was a person who's a natak Kodu, like a small height person. Her baby told them, I want to buy this baby, this person. So this is not he's a human. How he can give you? She is doing like that type of thing. This is the innocence of the person. This is the innocency of Pastella. And to all of you, you can ask the question. Here the Pastella is too much lengthy, but I'm going to just give the certain things.
Yes.